We need to stay true to the evidence and stay true to the science.
Dr. Mark Rupp, an infectious disease expert with the University of Nebraska Medical Center, says COVID-19 myths are a plague of their own.
Just a huge amount of wasted effort right now dedicated towards these things that I just wish we could devote towards things that were more productive.
He says masks work. Hydroxychloroquine is not an effective treatment for COVID-19, and the coronavirus is deadlier than the flu, adding, "This is all in the data."
I try to keep an open mind in my own reporting.
Tanya Lewis, a science journalist, is on the front lines of this battle of misinformation as well.
It's hard when, as you said, you're constantly sort of fighting a war on two fronts where you're trying to get accurate information out there, but also combat misinformation.
How frustrating is it for you as a journalist and a writer to continue to see these myths kind of be spread?
I mean, it's definitely frustrating. I think, especially as a science journalist, we sort of pride ourselves on following the data and the evidence, and clearly this administration has ignored both of those, and in fact, many cases kind of suppressed scientific expertise.
With the recent increase of COVID-19 cases in Douglas County, the herd immunity myth has made a resurgence, many believing the virus should just take its course.
Just opening up the gates and saying, hey, let nature take its course is really going to be reckless.
Dr. Rupp adds the goal is to move towards herd immunity, but he would like to see that done in a controlled setting with a vaccine. He says about 10% of the country has been hit with COVID, adding that is nowhere near herd immunity levels.
In order to get up to the 50, 60, 70% level of immunity, just think about how much more morbidity and mortality that we would sustain in trying to get to that number through just natural disease.
In Omaha, Kent Lutzen, 3 News Now.